We are defined only for this particular people who are affordable, non-affordable. No, it's not like that. See, palliative care means it's like any disease, any issues who comes to everybody. But what Athulya does along with the pallium is like experience, like they are trained more than this much of people. But Athulya as a senior care, we want to integrate as a palliative, because if you see the mostly 50% of the palliative care people who needs is the senior citizen. So since Athulya already is there in the senior care model, where we wanted to integrate, so it is not a very expensive, it is not any additional cost in that. It is a process. It's like how Dr. Sreedevi told. It's a training and how we want to handle the people. That is more important. So there's nothing like economic changes coming to senior care and palliative care. Almost the same. I just give it to Dr. if you want to add anything.
Actually quantify the money needed for palliative care, because palliative care should be done by everyone. That's why everyone in this room, if you have a elderly person next to your home, or you have someone who is bedridden next to your home, you can go there always and ask, how are you doing? Is everything okay? Do you need some help? That doesn't involve any money, right? It will take hardly 10 minutes. So it is not different. It is a speciality, but palliative care approach can be incorporated into any practice. Athulya is already seeing patients, senior citizens. When the doctor is going and seeing the patient, the approach should be different. Maybe you need to spend more time, you need to invest some money to get them trained. But it can be done by anyone in the society. If someone of you are interested, you can just go back and read little bit about the Kerala model of palliative care. There everyone does this job. It is the responsibility of the society. It is not something that you need to invest money or you pay for something and then get separately. It comes along with the care that they already provide. It's kind of bringing in quality of the care that they did.
Ma'am, there is any certain time for this treatment?
So, when should you start the treatment? Because palliative care is aimed at relieving suffering. So whenever I have a suffering because of my healthcare issues, see, when you have a respiratory infection, of course I suffer. But when you go to hospital, take 1 week of antibiotics, you're back to normal. That is not the case when a young man falls from a tree. He's on wheelchair for the rest of his life. It is not going to be back to normal at any point of time. The life is completely changed. So the moment the suffering is identified, they should start getting palliative care. So it improves the quality of life, it increases their independence, they feel meaningful, they feel that they are also part of everything. Not that they are just sitting in a room on the wheelchair, ending up with bed sores. So that is the time. The moment you know that there is a suffering associated with a long-term illness, that is the time palliative care should start. Till they die, and to be continued even after their death. Because what happens to the family? It is not just about the patient, right? It is about the family. The family also suffers. They can't go for their job. They spend the entire time near the bed. So it is also about the family, so we make sure that we are coping really well through our burial of the persons.
Is there any symptoms for this?
You mean what kind of symptoms are usually seen?
Like caring, or like, is there any effective for identification for them?
It varies from illness to illness. For example, cancer, pain will be the symptom. Pain, vomiting, sleeplessness. If you take a stroke patient, then being on bed for a long time, giving bed sores, urine and bowel issues, these will be the problems. So it varies from illness to illness. But the suffering becomes intolerable. We know that we are suffering and this is not going to end in a week or a week or 2 or 3. So that is the time where it is not dependent on the symptoms. It is dependent on the suffering.
For example, a cardiac patient, a neuro patient, oncology patient, general physician, any disease, anybody has any illness, the palliative care is additional services, because so this palliative care is not just another disease or another specialty. It's palliative care needs for every specialty.
So Athulya is going to help for the doorstep services?
Yeah, actually as Athulya we have a concept of at your home, at our home. That is what we have serviced more than 20,000 senior citizens at present. So what we have, because palliative care needs for home care, palliative care patients, palliative care clinics need, they can want to come stay. So we services both at your home or at our home. That's the services we do.
So you have any certain times for this?
Times means?
Means, from 9 o'clock to 6 o'clock?
No. See, when we say services, no time limits. See, because it's up to what kind of what they are able to do, what they want, what is they can afford, what lot of things are involved.